know that 30 to 40% of adolescent girls have severe period pain, bad enough that they're missing time off school. And that's huge. The education that we get in school as we're sort of starting to approach puberty is much more, I think, about the kind of practicalities of what is a period, and then, how do you manage it, towels versus tampons, and, I'm sure you remember that the average age of going through puberty starting periods is about 12 in the UK at the moment, yet people often conflate periods and sexuality together. So actually we have children, many of whom are still at primary school, who are starting their periods, and actually we should really be thinking about them as two quite separate things. It's really important that they understand that, there is now the risk that they could get pregnant, but many girls, when they're starting their period, aren't remotely thinking about being sexually active at the same time. Because we use hormonal contraceptives as treatments for period pain, it would be really nice if we had a different label for them, so that actually they were just hormonal treatments, rather than saying, you're 13 and your periods are really bad, so let's put you on the pill, and then sort of mixing it up with contraception. I think it would be much nicer if we could say, let's put you on a hormone treatment for your periods.